can I add something to that? Like, so if I'm assuming that most men 18 to 35 aren't doing blood work regularly, does that mess up those numbers also?
No question.
Because then those reference ranges would be higher.
No question, because there's a bias, right, for the population that gets tested, right? So you go to the lab, you're 40 years old, you go to the lab, you get your number tested, and that gets put against the totality of everybody that's been measured. So that means, 92-year-old grandpa over here, 16-year-old over here, the few that get it done, and most people in between. But again, these numbers are only meant to give you a statistical idea of where you stand compared to the population. Those numbers have never been studied, not for a minute, to indicate whether a given individual needs perhaps treatment or some maneuver to enhance that number. They've never been studied for that. Not testosterone, not anything else, right? Like, particularly look at hormones, but the same applies to all lab values, right? You can be within a range of whatever number, whether it be a liver enzyme, whatever the case may be, and be grossly pathologic if it's not appropriate for your number, if it's a change in your pattern, and you can be outside of that range potentially and not be something. I've seen people that have dealt with misery for years with every possible symptom of low testosterone that you can imagine, and they're turned away because their number is, at 302, and the range is 300. And then they'll talk to your physician like, well, it's too aggressive to put you on hormones. Let's not do that. But then they'll have no problem throwing 5 medications at them, right?